So now I'm doing his abdomen to lower extremities. First, I'm going to open this and look at the symmetry and contour of his stomach. So it's flat and symmetrical. Now I'm going to listen to his abdomen. Bowel sounds are normal, not hypoactive, not hyperactive. I'm going to do my light palpation. No muscle guarding and no tenderness. I'm going to do my deep palpation. Do you have any tenderness when I touch? Okay. So with deep palpation, no muscle guarding, no tenderness, and no mass present, no organomegaly present, and the skin, no discoloration and no lesions present. So I'm going to cover this up. And with the umbilicus, it's midline and inverted, and there's no inflammation noted and no hernia noted. And I didn't see any pulsation that is visible. Okay. So now I'm going to check on his legs. So here, the lower extremities are equally distributed. Cap refill, I'm going to check again. Prompt and push against my hand. Plantar flexion is good. Push against my hand. Plantar flexion is good. Dorsalis pedis 2+ is strong. 2+ is strong. And can you grip my arm, my fingers? Okay, hand grips are good. And that ends my head to toe assessment. Thank you. So for my head to toe assessment, Mr. Luke Chandra is awake and oriented with his name, place, time, and date. And overall, his skin color is appropriate with his ethnicity. His skin is warm, dry, intact, and no edema present. When I touched his pretibial, there was no edema that I felt, and no rash, lesions, and normal hair distribution is present on his extremities. Good skin turgor, no clubbing on the nails, no biting, signs of biting, and no discolorations of the nails. Nail beds are firm and pink. Cap refill on fingers and toes are less than 2 seconds. For his eyes, he is not wearing any corrective lenses. Pupils are reactive to light and constricted and equal bilaterally. Scleras are white. No signs of jaundice, no lesions or redness, no nystagmus or no strabismus. Conjunctiva is clear. Corneal light reflex symmetric. Mucous membranes are pink and moist. No lesions noted. And for his ears, the tympanic membrane is shiny, translucent, pearly gray with a light reflex. Whisper word test is good. Hearing is intact. Radial pulses 2+ is strong bilaterally. Dorsalis pedis strong, 2+ equal. and no edema present on pretibial, and no pulsation and no visible heaves or lifts on the heart or on the chest. Rhythm was regular on the aortic area, pulmonic area, Erb's point, tricuspid area, and mitral area, identified and heard S1 and S2, no murmurs, no S3 and S4. For thorax and lungs, lung expansion is symmetrical, AP is less than transverse, appropriate skin color, no lesions, no skeletal deformities, clear lung sounds, absent or no adventitious breath, like no wheezing, no rales, no ronchi heard upon auscultation. Abdomen, his abdomen is symmetrical, no visible bulging or mass present. Skin color is appropriate with ethnicity, no lesions, no rashes, no pulsation, no inflammation or no hernia. Umbilicus is midline and inverted. Normal bowel sounds upon auscultation in 4 quadrants. It's not hypoactive and it's not hyperactive. And upon light palpation and deep palpation, there was no muscle guarding, no tenderness, and no masses and no organomegaly present. His spine is straight, head erect, firm, no muscle spasm or tenderness, no scoliosis, no kyphosis, no lordosis, and hand grip is 5 plus strength, plantar flexion 5 plus strength. Thank you so much.